Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Labzquad Omega. This audio podcast is part of Storm Squad. This audio podcast as part of a ZtormLabostix production. In this audio podcast, I look in and around so I'm looking around and I'm following on from the intro, following on from the intro. Now looking in on this audio podcast, in on coping kidney disease and young people. So research surrounding coping among young people with a chronic illness continues to expand, particularly in relation to psychological adjustment and self-management within chronic pediatric disease or within chronic pediatric populations. Evidence suggests that young people with CKD use a broad range of coping strategies, and this is evident. This is evident in CKD, where ongoing sort of clinical modalities and demands such as dialysis, transplant evaluation, pharmacotherapy adherence, and and some of the sort of aspects that pertain to the clinical restraints place sustained cognitive can place sustained cognitive and behavioral demands on young people. One limitation of many investigations is reliance on quantity on in around quantitative survey methodologies, which may fail to capture the situational individual variability in how young people appraise and respond to sort of stressors. Coping has also been conceptualized as an adaptive regulatory process that supports psychological well-being and functioning in young people managing chronic illness and ongoing health-related stressors. Research investigating coping in chronic illness or illnesses must consider the interaction between illness-related factors, treatment demands, and broader psychosocial influences, including socioeconomic circumstances and family support and sort of family support mechanisms. In pediatric populations, additionally, coping should be understood within the developmental and family context as emotional development, family function, and broader psychosocial environments all collectively shape sort of adaptation to and in around children and young people that suffer with with particular chronic illness or chronic illnesses. At the same time, many young people with CKD and other chronic illnesses or conditions can manage routine daily stresses effectively and under typical circumstances. However, recurring symptoms or treatment modalities and period and sort of durations of, for example, hospitalization, contribute to stress factors that often require repeated psychosocial and behavioral adjustments in those affected. At the same time, additionally, in CKD, these challenges are often compounded by complex by complex ph- by complex pharmacotherapy regimens, fatigue, or fluctuating sort of aspects of HRQOL or health related quality of life, which in turn can disrupt across maintaining can disrupt across as well maintaining sort of aspects of across different across different sort of relationships and aspects and across healthcare. Although these difficulties may be less clinically maybe sorry maybe less Although these difficulties may be less clinically, the psychosocial challenges are have been evidenced in amongst the literature, with evidence highlighting the impact of of burden and disease related restrictions or condition related restrictions on emotional well-being, autonomy, and familial relationships. Collaborative and longitudinal research is required or has been required to sort of to thus to thus to thus to thus highlight a deeper sort of understanding of coping among young people with CKD and other healthcare conditions, in following that of works by Mohammed and team from 2016. Relating to to condition related pain, younger children aged 7 to 12 years demonstrated a greater reliance on illness focus and negative emotional coping strategies, whereas adolescents aged 13 to 17 years displayed greater consistency in active coping approaches over a 9-month duration. More recent research similarly indicates that developmental maturation during adolescence is associated with increased use of adaptive cognitive coping and self-management strategies in chronic pain contexts. Qualitative research examining or investigating children's hospitalization experiences identified distraction strategies, for example, play activities and maintaining aspects of normal daily life, as sort of the main coping mechanistics for managing stress, managing sort of challenges during hospital visits or hospital stays. Supportive and emotionally positive interactions with healthcare professionals were also found to facilitate children's coping and adjustment during hospitalization. Theoretical 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 approaches to coping in young people with chronic illnesses share many similarities with broader models of coping and self-management. Contemporary models conceptualize coping as a multifaceted process involving a range of cognitive and emotional behavioral responses to stress. These responses are influenced by several developmental factors, such as young person's cognitive ability to recognize and respond to stresses, emotional regulation, and the development of an individual's unique coping style. Contemporary theoretical and empirical research continues to examine or investigate the relationship between cognitive appraisal and coping responses, the developmental and contextual influences on coping with stresses, and the relevant and the extent to which active cognitive and behavioral efforts promote adaptive adjustment. Coping should thus be understood as involving both sort of the psychological or sorry the across coping should be understood both from the physiological and psychological, but also where there's interlink between the physiological and in context of the psychosocial processes, including interactions between that of the immunological and neurobiological systems. That draws this audio podcast to a close. This audio podcast as part of the Labzquad Omega. This audio podcast as part of the Storm Mode Squad. This audio podcast as part of a ZtormLabostix production.